Ashley. I'm the nurse here today at the Women's Health Clinic.
Hi.
Hi. Are you Amanda?
I am.
Hi. So I see that you're about 20 weeks along.
Yeah, I'm 20 weeks along.
Okay. So I hear that you have some questions for me about what's going to happen after your baby's born.
Yeah, I mean, I've gone over most of the details with my midwife, but I've heard that my baby will be getting a shot of vitamin K, and just thinking about her getting all these shots after she's born, I'm just wondering, like, does she need it? I wanted to just know a little bit more about this vitamin K shot before I agree to another shot.
Okay, that's understandable. So I can provide you with some information that will hopefully help you make a decision. What vitamin K is it's a natural substance in your body, and it helps your blood clot, and you need a certain amount of vitamin K in order to prevent serious bleeding. You can acquire vitamin K from certain foods in your diet, like green leafy vegetables, kale, spinach, broccoli, cauliflower, things like that. Also from fish and certain meats. Vitamin K is also made by the bacteria that line your gastrointestinal tract.
I mean, my babies will be so small. Why is it important for my baby to have vitamin K?
Well, all babies are born with low levels of vitamin K, and this is because they don't have enough bacteria in their intestine to make the amount of vitamin K that is needed to prevent serious bleeding. Even if you plan on breastfeeding, your breast milk contains a small amount of vitamin K, but it's not enough to protect your baby. So because of this low level of vitamin K, essentially all babies are at risk for a disease called VKDB, and that stands for vitamin K deficiency bleeding. It's very rare, but it can be prevented by giving newborns extra vitamin K.
So what exactly is the risk of my baby developing VKDB?
Well, like I said, it's very rare. Even in babies that have not been given vitamin K, it occurs in about 1 in 100,000. But when vitamin K is given shortly after birth, it can reduce that risk to less than 1 in a million. Typically, if they do acquire VKDB, it happens within the first week of life, but it is very serious, and it can cause bleeding into the brain, which can result in brain damage and possibly even death. So because of the severity of the disease, we highly encourage all moms to have their baby receive vitamin K.
So how is vitamin K given to my baby?
The current recommendation is that vitamin K be given as a single injection into the muscle of the leg. It's 1 dose given shortly after birth, and it's enough to protect your baby until they're able to make enough vitamin K on their own.
Well, can all babies have vitamin K?
Yes, all babies need vitamin K, and this includes babies that are premature, very small or sick, and even babies that are going to have surgery. So we encourage all babies to receive vitamin K injections at birth.
Well, okay, so how safe are vitamin K injections?
Giving vitamin K by injection has been proven safe and effective. Some babies may have slight swelling or soreness at the site of injection, but this typically lasts just a day or two. Overall, it's very safe, and it hasn't been shown to cause any serious illness.
So say I don't go through with having my baby get the vitamin K shot, what exactly can happen to her if I don't?
Well, ultimately the decision's yours to make. And if you do decide that you don't want your baby to receive the vitamin K shot, that's okay, but there are a few things that we want you to look out for, specifically symptoms of VKDB. So things like easy bruising or increased bruising around the head and face, bleeding from the nose or oozing from the umbilical cord, irritability, vomiting, and skin or gums that are paler than usual, things like that. So if you see any of those symptoms in your baby, then you need to contact your healthcare provider right away, because that could mean that they have VKDB.
Wow, okay. Well, thank you so much for all this information.
Yeah, I know it's a lot to take in, and I have a handout here for you that you can take home and review this stuff a little bit more. If you have any more questions or want more information, never hesitate to contact your midwife.
Okay. Well, thanks, Ashley. I really appreciate you taking time to talk to me about vitamin K.
Yeah, you're welcome.